everybody, it's Dr. Bowers and Dr. Cornish and, Uno. We're coming to you today from inside our learning lab. We had put a call out onto social media just to get some questions answered for you, and so we have a few questions that came from you all that we are ready to answer.
Okay, the first question. I hear you talk a lot about total body dentistry. What does that mean?
We like to look at dentistry from the perspective of looking at your whole body, not just your tooth, not just 3 teeth, but everything. We like to consider what we do as healing the human body through dental health, and that includes us looking at blood sugar, blood pressure. What are the consequences of missing teeth? What are the consequences of decay or cavities on your teeth? What does that do to your whole body? Because in reality, the mouth is, we can relate it to that old phrase where they said something about a canary in the mine, that the mouth really starts to tell us what's going on in your whole body. And that's really important for us to look at.
Awesome. Our second question, do you see children at your office? At what age should my child come in to see you for the first time?
Okay, great. Well, I'll take that one. Yes, we absolutely see children in our office. We actually are very passionate about seeing children in our office. We are not specifically a pediatric office, but we do like to make special arrangements for kids when they come in. We have created a hands-on health lab, which is where we are coming from today. And in that hands-on health lab, children will get to perform an age-appropriate experiment every time they come in to get their teeth cleaned. You know, if you're bringing in a 2 or 3-year-old, that might be something as simple as reading a book to get them comfortable before they're sitting in the dental chair. If we're talking about middle schoolers, maybe we're pulling out the microscope and looking at their saliva. So there's all sorts of different things that kids get to engage in when they're here with us. Something outside of just sitting in the chair and showing them how to brush and floss. So it's our way of really getting children to engage themselves in their oral health and starting that process for them. As far as what age, so the American Dental Association recommends within 6 months of the eruption of the first tooth. What that means is typically we would like to see most kids around age 1. Those kids are not coming in to sit in the dental chair and get their teeth cleaned or, sitting by themselves. It's mostly a chance for us to talk with the parents, give them a little bit of information that they may not already know about their kids' teeth. We're going to talk about their development, their diet, what to look for as their children are growing. We're also going to get a chance to look into their mouths and make sure there's no decay starting, because early childhood decay, it's the second most common disease in children, second to the common cold. So it's really important that we can catch this early in children and change things for them. The other thing we can check is look for tongue ties so that we can hopefully prevent future problems for these kids as they are developing, things with speech, swallowing. All of that's really important for us to check at an early age. So those first appointments, although they may seem simple, they're very important for setting the stage for that child as they grow and as they become more comfortable in our office.
Wonderful. And the last question, last but not least, I think Uno is super cute. Can I request him at my next appointment?
Uno is super cute. That is a given. Absolutely. Uno comes to work 4 days a week typically, and even if he's napping, we've been known to wake him up just to take another nap on your lap. If you want to sit with him, just let us know, and we will make those kind of arrangements. For the kids, we do keep them in a stroller, just a little safer for everybody that way, and they keep their hands in there and they can pet him, and everybody loves it. And then of course they get to push the stroller around the office, and that may be every child's favorite part.
Awesome. That's it for our questions for today. If you guys have any last words.
Thanks everybody for just taking a minute
you.
to listen to what we have.